Hello everybody and welcome to the Tuesday edition of Video Clips. And no announcements about events today because in December we start to wind down a little bit. We don't do as many conference calls and classes and that sort of thing, but we'll be back in January with all kinds of exciting programming. I do want to make an announcement. Healthy holiday gifts from the Wellness Farm Kitchen. We have some great things this year. A signed copy of Forks Over Knives, the cookbook. I've given that book as a gift to a lot of people. They love it. The Healthy Snack Box includes organic trail mix and zesty kale chips, and our kale chips are low fat. If you've been in the store and bought kale chips lately, you know how high in fat they are. Ours are low fat. And we have a healthy cookie box, raw granola, gingerbread biscotti, which we had some for lunch today and they were out of this world. So we have a whole list of things. You go to our website at wellnessfarm.com and see it, or send me an email and I'll send you the list of items that are available. I've always said, really, at holidays, people do not need another sweater. They don't need any more tchotchkes for their coffee table. They really need healthy ideas, how to live their lives better, and these products are really great for that. So, news for today, two things. I want to talk about blood pressure medication. I've been putting out messages for a long time, and I think I might have even talked about this last week, about we shouldn't really be medicating high normal hypertensives or people with mild hypertension. And a study that I read this past week talks about the inadvisability of giving blood pressure medication to people over the age of 66. We should exercise more caution because, according to the study, blood pressure meds increase the risk of a hip fracture by 43% during the first 45 days that people are on the medication. And the reason, according to the researchers, and this absolutely makes sense, is the hypotension that results from starting people on blood pressure medication. Now, obviously, blood pressure medication is warranted for some people, but we should just be exercising more caution in terms of how much of it we prescribe. Patients with conditions such as diabetes, prior cardiovascular events, renal disease, those who were living in nursing homes were excluded. So the sickest of the sick were out of the study, and they still found an increased risk of fainting and hip fracture during the first 45 days that people are on medication. So why is there so much resistance? Well, if half of the people taking blood pressure medications cease to do so, we're going to see a huge drop in drug sales and medical visits. And so the industry likes to hang on to its turf. Now, one thing I'll add is that if you are taking blood pressure medication, don't abruptly stop. You need to visit your physician and be properly weaned, and the protocol varies depending upon which medication you're taking. One thing I'll just add to this is the day that I read this study, I was in a yoga class later that day, and one of my yoga buddies told me that on Thanksgiving, her mother-in-law fainted in the kitchen, and the reason, she had just been recently placed on blood pressure medication. So once again, there is a time and place for blood pressure meds. We just prescribe them way too often. So while we're on the topic of useless things and or harmful things, fish oil pills. You guys have heard me talking about this for years. Many health professionals are still promoting them, saying that they're good for cardiovascular health, and the evidence just doesn't back it up. I use a study in our Wellness 101 curriculum book, and I've talked about it a lot. That was a large meta-analysis of 89 studies that was published in the Journal of the American Medical Association, or in the British Medical Journal rather, that shows that fish oil pills were useless and that they could not rule out an increased risk of cancer. Now, a new study, and this one is published in the Journal of the American Medical Association, confirms it, and it was also a meta-analysis. 20 studies with 68,680 participants conducted over the last 24 years were included. And in both of these meta-analyses, I think it's important. These are lots of studies and an extremely large group of people. I mean, we can't criticize the researchers for not drawing on a big enough cohort here. The patients included in the studies took an average of 1.5 grams of omega-3 supplements for an average of 2 years. And I'll read you, this is a direct quote. There was no difference in the, quote, risk of all-cause mortality, cardiac death, sudden death, myocardial infarction, or stroke based on relative and absolute measures of association. That's directly lifted from the article. Now, in other words, the results were so bad that even when expressed in relative terms, which is how the drug companies make their useless products seem valuable in some cases, there was nothing good to report. Now, it doesn't seem to matter, of course. This study was published in September of this year, and I went to the American Heart Association's website, and they're still advising people with heart disease to eat fish or take fish oil pills. And I took this right from their website on November 26th, just earlier this week. The American Heart Association recommends eating fish, particularly fatty fish. My gosh, what heart patients need is more fat, right? At least 2 times, 2 servings a week. And then it goes in to describe what a serving consists of. And then it says increasing omega-3 fatty acid consumption through foods is preferable. However, those with coronary artery disease may not get enough omega-3 by diet alone. These people may want to talk to their doctor about supplements, and for those with high triglycerides, even larger doses could help. I mean, when is the American Heart Association going to get with the program here and start recommending a low-fat, plant-based diet to reverse heart disease? Now you guys can understand why I'm so frustrated with disease groups and why I don't support them financially. Well, not only does research show that fish oils pills are useless, research shows that all oils promote weight gain and coronary artery disease. And I guess this is one way for the American Heart Association to make sure it has a steady group of customers, because anybody following their advice, including the one to eat fish and take fish oil pills, is going to have, is likely to end up with progressing heart disease. The AHA is not alone. I don't want to pick on them only. An internet search brought up many sites with doctors and nutritionists stating essentially that it doesn't matter what the research shows. They're going to continue to recommend fish oil pills. And as I've said many times before, my colleagues are not easily convinced by evidence. So the bottom line, stop taking fish oil pills. Don't let anybody talk you into taking them if you're not. No evidence that they're beneficial, and some evidence that they may be harmful. So that's all for now. Have a great day. As always, pass this on to anybody who you think might enjoy watching it. And I will be back on Thursday.